Indiana driver's license. They're gonna talk about yeah, yeah, it should be once it came out of our committee, subcommittee.
We ready? At this time, I'd like to call the meeting to order. First item on our agenda is a roll call. Jenny, would you do that for us, please?
Present.
Present.
Present. Present. Present.
Thank you. We have a quorum, correct? Next item on the agenda is the adoption of the agenda. So it is recommended the Board of Health members adopt the agenda, this agenda that is in front of you.
I will move to adopt the agenda.
We have a motion. Do we have a second?
Second.
Any further discussion on the agenda? All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is the approval of minutes. First item is the approval of the minutes from our regular meeting of September 13th, 2023. I'll entertain a motion or we have a motion. Do we have a second?
Second.
Any further discussion on those minutes?
I think the only question I had was, do we need to have in the minutes every single little motion that we made about changing the septic ordinance? I think that was the September meeting, correct? Or we just,
No, that was,
or is that?
it wasn't, was that, no, that was.
That was September. Yeah, that was September.
Or do we, or is it be okay to just have in the blanket? Clarify with the discussion.
Yeah, because the way we currently have it written was just that blanket, that there were multiple. What do you think, Marcel?
There's a lot.
There were a lot of motions.
Yeah.
I think doing a blanket's fine. We've got the recording of it in case anyone wants it, so they can go back if they need it and we'll happily give it to them. But I think it's fine.
The meetings will get unwieldy.
Yeah,
Everything.
I mean, that one was a special take, right? You don't usually go through 100-page documents line by line. At least I hope we don't usually do.
I hope not. Whatever it takes.
You gotta do it, gotta do.
Any further discussion or questions? All right. Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item is the minutes from the October 3rd special meeting, October 3rd, 2023. I believe everybody has that in front of you. So entertain a motion.
I move to accept the minutes from the October 3rd meeting.
I'll second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is board president announcements. I have no announcements. The item after that, health officer presentation and report.
Great, thank you. I'd first like to start off by seeing if there were any questions, and then I'd like to move on to just giving some updates regarding the septic ordinance, the HFI update, and then moving to our spotlight, which is nursing. Any questions before I start discussing those things? Okay. With respect to the septic ordinance, thank you everyone for the hard work that was done on September 13th. It's greatly appreciated. On October 10th, we had our first reading. We will have the septic ordinance go to council committee next week on Tuesday, the 24th. And we'll keep you updated as that progresses. With respect to the HFI, Health First Indiana, we've had a few updates. The finance committee did the special meeting. Thank you very much for that. We sent it to the state and everything went well with that regard. The second part of that conversation was the budget, which we will be discussing from the HFI. But we had a grant component to that. And so one of the things that we wanted to talk about is the process by which we will be providing grants to our community partners as we move forward with HFI. And this is separate from how we plan on distributing that money internally within the department. This is how we're going to be spending the money within the community and making sure that we are successful in how we identify the appropriate grant applicants, and then how we ensure that they are meeting the KPIs that we've created and having success for our county in 2024. So to kind of outline that process, I wanted to invite Robin Vita, who's been doing some really great work with that, and our team to kind of provide an outline of that process for the board.
Are the board members all familiar with Dr. Purushotham's strategy there with regard to these grants? I don't know if you've heard much yet, but so about roughly $1 million of the Health First Indiana money, rather than trying to hire staff and staff up to try and to advance the health department's initiatives, as well as what the state's asking us to do. I believe Dr. Purushottam is proposing that we do a grant program that way, you know, if something happens with the funding in 2 years or whenever, that we don't have employees which are expensive to bring on and tough to keep to deal with if the funding should dry up. So it seemed to me like a really clever way to address that concern, as well as getting really good partners that are already in the community activated to.
Right. And that's exactly the process that we talked about at the finance committee meeting, just kind of spending time and paying attention to what our community partners, our health systems, and the feedback that we got from our listening sessions about what the needs were within St. Joseph County, and then breaking that down to what does the health department need in order to continue to sustain those programmings that are important. And then taking a portion that was left over, which is a little bit under $1 million, to make sure that we're able to support community partners that are addressing some of the issues that perhaps the health department is not at the best place right now to be carrying. For example, the STD clinics, and ensuring that we've got access to that. That's not something that the health department currently does, but there are community partners and clinics that are doing a really great job at that. So figuring out how we can encourage and support people who are actively right now doing the work that we need to do to use the funding to continue to grow that impact today, rather than spending time developing an infrastructure that would take us a while to execute some of the work that's already been done, and also to ensure that we're building partnerships within the community, and truly that the health department is a scaffold for our community partners so that they can be successful and reach more people in an impactful way, and that we catch everything that is not already being addressed so we can have a healthier community. So that's kind of that background. Thank you,
Great, thank
Mr.
you.
Lynn.
Great. Everyone can hear me okay? Okay, good. Robin Vita, Director of Health Outreach, Promotion, Education. So in front of you, you will see a proposed grant timeline. As Dr. Purushottam mentioned, a key strategy for success here is ensuring that while we internally have our teams and our efforts in line, working with key community partners is going to be essential for success in improving health and health outcomes. So you'll see our process laid out very, very nicely here. The letter of intent, this is a mechanism we'll use to just gauge interest. So reminding us of the 22 core public health services, Department of Health is choosing to accept LOIs and eventually full proposals in 8 of those 22 categories. And that is where we will solicit those letters of intent. So we published that publicly yesterday. And we will have our community meeting of community partners coming up this Monday at Howard Park. That is in opportunity for individuals and organizations looking to utilize Health First funds and or apply for that process to attend and be made aware of what that entails. So after that, and we're calling it more of a workshop because it is a opportunity to collaborate and think through critically how best we can achieve our key performance indicators. So the morning after that meeting, the letter of intent will open for submission. So individuals who we have asked them to RSVP to that event. So we are aware of who's coming, and that's a way we're going to use some breakout sessions around those individuals and what core services they're intending to apply for. That morning, they will receive an email and or on our website, they will be able to submit their intent to apply. We will have internally meet daily to review those LOIs and decide which LOI we wish to see a full proposal from. So not all LOIs or letters of intent will fulfill that full proposal ask. Individuals and organizations will have until the 10th of November to submit a letter of intent. If a full proposal is requested, that will be due November 22nd, which will then kick off our review period. The review period of those full proposals will consist of an internal committee with unit director support as needed, as well as community experts as necessary. So ensuring that we are being very mindful and intentional with who is doing the work and or proposed work and services. And then after that, there's a public presentation that would be asked of those full proposal submitters, where we would have them be present. Hopefully, we put in 12-13 here, knowing that the Board of Health meeting usually in December is moved up a week. We would like the Board of Health support in hearing those presentations of the individuals we think should be funded for those proposals. And then once that's done, once the presentation is done, we will submit a letter to the Board of Health for final approval, and then submit that to our county commissioners. As you can see, it's a very tight timeline. Notice of awards we'd like to happen in December so that we can optimize the amount of grant funding time. So we'll have a notice of awards, knowing that appropriations and contracts need to happen in the beginning of January through the county council as well as the county commissioners, looking at when contracts signed contracts would be due so that awards could begin on February 1st. That allows for 11 months of program activity. And then there are, at a minimum right now, we're thinking 3 quarterly reports that will be expected. And I shouldn't say expect, they're required, as well as an annual or final report, which will be necessary for them to move on. One thing I skipped over, letter of intent review will be based on alignment with the proposed state minimum KPI, as well as potential impact in the community. So those are 2 of the most important criteria that we're looking at, since we do know at a minimum, it's the state KPIs, and then in addition, individual KPIs per program, activity or project that is funded. Questions?
So the notice of awards, that's just coming kind of out of the department or out of the Board of Health, and then it goes to the commissioners? and then to the council or just to the commissioners, or how does this funding?
The commissioners up to some.
Right. The commissioner, I don't think it goes to the council.
Okay,
Is it to go to the council when when the, funding is distributed? Is that?
Appropriations.
Okay, so the December it'd go to the commissioners, but then the appropriation go to commissioners.
Oh, so I think we're trying to figure out the grant approval process. Yeah, I feel like it's almost the same way as when we apply for grants. We have to accept them. So in terms of board approval, commissioner approval to.
The commissioners, we'll ask the commissioners to sign the contracts in January.
Okay.
We have to have the funds appropriated first through the county council and the county commissioners before we can execute the contracts. So we will send, on the agenda today is the Health First Indiana budget. That'll be submitted for the council committee in December for their public hearing in January. And then the following week, the commissioners will vote on those items from the public hearing. And then that following week is when we want to execute those contracts.
great. Got it.
So, the 12-13, you say public presentation, so are you planning on having, potential awardees come to?
Yes.
the Board of Health meeting?
Correct.
Okay.
Yep.
So we probably need to plan on more.
Yep.
Is there anything else you wanted to add about, Dr. Chuckman about?
No,
what-
I
what
just
you're-
wanted,
I-
no, I was just gonna comment, that was the idea that,
Yeah.
we invite them to the Board of Health to ask questions, to listen to the
Mhm.
presentations, to make sure everyone feels comfortable with it. And then we will give the final list of individuals that will be awarded the fund for final approval. And it would be just the list of all of the awardees and their amount. And it would be one vote regarding all of them. But I just wanted to provide some
Mhm.
clarity about what that would look like.
So on the KPI reporting is quarterly, is that, I assume that's adequate for us to meet our obligations with the state regarding
Yeah.
KPIs?
And the nice thing is one of the systems we currently utilize, our RedCap system, we're able to tie all of these things together. So an LOI with a full proposal with then the reporting piece. So that the thing I appreciate the most about that is some things are automated. So it'll send an automated message saying, hey, it's time for you to submit your quarterly report. But even more importantly, we can create a standard outcomes and measurement that we take from everybody in addition to the KPI specific to their program. And then we'll easily be able to see what that looks like. And that's important.
You mentioned that.
Riley, your mic is not on. Can you
Was it not on?
speak into it or?
Or maybe it's just not close enough. There you go.
Thank you.
I think, Robin, you mentioned that the letters of intent were
Can you-
posted
can you hear
publicly yesterday.
Mhm.
You might need to move
No,
it closer.
Okay, I just said, you mentioned that the letters of intent were posted publicly yesterday.
It was posted in Mishawaka Enterprise yesterday as an effort to have that posted prior to the community meeting. However, that submission portal is closed until after that community meeting. So people can see it, they just can't submit anything.
Sorry,
That's
we're
okay.
dealing with this too.
Yeah.
Where can we look to see?
It's on in Mishawaka Enterprise. They post on Thursdays, so that will post tomorrow. And then we've asked them to post it for 30 days.
And then we also did a press release.
Yes.
We ensured that all of the partners that have worked with the health department also got an email. We used the Health First Indiana listening survey. Some
Mhm.
people put in their requests or talked about some other programming in there. We made sure that all of those individuals that had reached out to us were notified of this process. Just trying to make sure that everybody who's interested or everybody who may be involved has an opportunity to attend and is given a similar amount of time to prepare and come to the meeting and then all start off on the same basis.
Can we get copies of the
Mhm.
proposals, just so that we're kind of like aware, just kind of in the loop? Okay.
Yeah,
thank
Yeah,
you.
a copy of the LOI. That's what you're
Yes,
looking for.
thank you.
Yeah.
Yes.
Any other questions, concerns, thoughts?
I have one, I was just
Mhm.
waiting.
Yeah.
So on the community meeting,
Mhm.
is that for invited partners or is that really a community meeting and we're advertising, letting everybody, the public know that
Mhm.
they may or attend if they wish or not?
Yes, so that is an public meeting open to organizations that are interested in understanding the process and applying for funds that we have publicly available. That was communicated as Dr. Pershotha mentioned, through a press release, our social media, our website, several email listservs and other community partners so that individuals are aware that they can come. We're just asking them to register so that we can group them appropriately for the breakout sessions.
And we also want to make sure that everyone who's coming is coming with the intention to apply or interest in applying. Because we've done a lot of our hearing sessions with our community. This
Mhm.
is for those that are specifically interested in applying for a grant.
Yeah.
To understand what does the grant process look like, what are we expecting, and to answer any questions regarding that before we open the letter of
Mhm.
intent the following day. And so they'll have a copy of all of the different things that
Mhm.
they will have to work through.
Sounds great. I assume from the legal standpoint and contractual standpoints, our executives are on board with all this, or is it not yet? We're just a little,
Well, we don't know what the proposals are gonna look like yet, but I'm.
but just a general concept of us granting is, okay, great. Very cool. Any other questions or comments?
This is a bit tangential, but how was the response from the surveys and the community meetings? I'm trying to think, there was a couple even after our last board meeting, I believe, correct? Couple of
Correct.
Meetings, yeah, what was the general response?
So so we did the 3 public meetings. The first one by far was the best attended. The other 2 were not nearly as well attended. However, we did have a total of 318 surveys completed online with some very, very good information from I'm not sure really what the Department of Health does, so I'm excited to learn more. People that have recommendations or the areas they think we can improve upon. And then we, and I know this, just looked at it today, am encouraged that the KPI or the core public service areas that we're looking to seek proposals from are where our community is saying that they're aligning, they're matching up, and that's reassuring. Just reassuring that we know we are where our community sees some of our need too. But yeah, it was a learning process.
Any other questions? On the grant program or anything else on the health officer's report before we're gonna go to the spotlight?
Yes.
Before we go into the spotlight.
All right, well.
Good. Thank you.
So next up, we're gonna have Jody, our Director of Nursing, come up to give us a highlight about what our nursing department is doing and how they promote the health of the county and some things to look forward to this month.
Hi, thank you, Jody Peretz, for Director of Nursing on the 9th floor. Thank you for allowing me to come up here and talk about our unit, the core services that we are providing. And then I would like to talk about the challenges and our goals for the next year. So the nursing division, our main goal is to prevent the spread of communicable disease through immunizations and through public health disease surveillance. So we have 3 core services. We have public health nursing, tuberculosis, and immunizations. With public health nursing, we have communicable disease surveillance, conduct investigations and case management. We also provide lead monitoring and case management for children. With tuberculosis, we do provide direct observed treatment with therapy medications, conduct contact investigations for latent and active TB, and we also work with the providers on the care plan for education with isolation, different precautions like that. And finally, immunizations, we have 4 active clinic locations that provide vaccine regardless of insurance status. And we do TB testing, and we also do lead testing for children the ages of 7. So I'd like to kind of go over all 3 of the different core services separately. And like I said, I'd like to show what we do and then some of the challenges and goals for this next coming year. I'd like to start off with public health nursing. So public health nursing right now is managing over 77 lead cases with our public health nurse. Our disease investigation specialist that focuses on lead is managing around or monitoring around 116 cases. So total is 193 cases that they're working with. And what we do is we provide education. We work with physicians on labs, work with environmental to provide less lead risk assessments and testing in homes and family for the families. Our nurse provides education on cleaning, identifying what items might have lead in them, and the importance of following up on leads to make sure that the children's leads are going in the right direction. In addition to that, we have 71 communicable disease cases right now until we have more staff. Thank you so much for allowing us to move forward with an additional DIS or disease investigation specialist. But we have those 71 communicable disease cases. Our goal is to take those back as soon as we onboard our new disease investigation specialist and cross-train our nurse with that. Okay. Now that we've talked about that, I'd like to, if I could say regular communicable disease, I'd like to talk about our tuberculosis. We have 1 full-time public health nurse and a disease investigation specialist that focuses only on tuberculosis. We have approximately 21 open latent TB cases and 2 active cases. Out of these patients, we have done approximately 34 home visits and provided over 42 direct observed therapies, which could be our staff going out every day for 3 months or once a week for 4 months, depending on what the physician prescribes. I also have, what's really exciting is I have 4 staff members starting. They're going to ND tomorrow to be trained by state so that we can start drawing quantiferons for our TB patients or any person in the community that might want it, refugees, whatever, we'll be able to provide that. What is important about that is we'll be able to identify patients that are positive for TB, potentially treat them with their clinical provider, monitoring them with medication so that hopefully we don't have any more active TB cases. So that's exciting. However, it leads me to some challenges that we're having in TB. The 2 big things are, one is drug shortages, and then secondly, finding clinical physicians for some of our patients. There are a few medications that are prescribed, which we can get free from state. However, there are limited in supply. The main medications are, for example, isoniazid, INH, rifampin, Prifton, and vitamin B6. We have been notified by state that there is a limited supply, so we only have certain medications that we can use. One of the big ones is rifampin, that we are using for latent TB. An issue with that is it interacts with a lot of medications. So we are trying to work with other providers to receive more medication to disperse. Physicians, we are working, talking with different providers, residents, to make sure that we have services for patients that come in that don't have a clinical provider. So. Okay.
Could I ask a quick question on
Yes.
why are we having drug shortages? Is that what's going on there? And is there a solution?
State only receives a certain amount of medication. So, for example, isoniazid is one medication that is a good medication to treat TB patients with. They're holding on to it for active TB patients. So we kind of have to wait until they have more. And it can be different things like, lack of the supply, or I think there's some issues with production of some of these medications. It's just being government and, only having so much.
You mentioned maybe looking for other providers. Is that?
Mhm.
So we don't have to totally rely on the state. We can go elsewhere if we have the funds or not?
Right. Well, there's limited, our TB nurse and the disease investigation specialist, along with state, are working to try to figure that out. Yeah. So,
Can I ask one more question?
yes,
On the clinical physician side, what's the major hurdle with connecting patients to? clinical
there
physicians?
are, from what my TB nurse is saying, there are limited numbers of providers that take on new patients. Right now, we're working with Indiana HealthLink to have our patients go there, and the resident program at Memorial. However, they are getting full. So, the question is, where do we go from there? So I've been in communication with some of the residents. That's one of my goals this next year, is to talk with some of the programs to see if we could make some kind of agreement, find some resources that we may not potentially have. So that's definitely a big goal.
Thank you.
You're welcome. All right. So now that we've talked about public health nursing, I'd like to move on to immunizations. We have 2 in-house immunization clinics, one in Mishawaka and one in the County City building here on the 9th floor. Both clinics are open now Monday through Friday, which is exciting. And we are working later hours twice a month here in South Bend to provide different hours for people that work during the daytime or just can't come to us. And then our mobile clinic is working with community providers to go out and provide more immunization clinics out in the community, for example, schools. They're working hard to go and talk to their parents or guardians to get consents to try to go ahead and get those kids up to date. Since the pandemic, we're still trying to catch up on just childhood vaccines. So, but an example today, they went out to Motels for Now and wound up giving over 100 shots. So there is a need in the community. But additionally, I'd like to talk about October 5th, we opened up our respiratory clinic. And this provides additional appointments for flu and COVID. Having those appointments provide easier access, which is very important because the CDC states this year that we not only have flu and COVID, but we also have RSV. CDC indicates that the very young, elderly and people with different comorbidities like chronic lung disease, diabetes, cardiac disease are examples, have the greatest risk of hospitalizations and potential death during the RSV cold flu season. Timing of immunizations from these viruses is very important to prevent severe disease, along with hospitalization. The season usually starts around October and ends in March. So again, thank you for the earlier meetings so that we could go ahead and get approval to provide those vaccines to our community. We are now able to provide all 3 vaccines at our clinics, which is exciting. And the American Academy of Pediatrics and the Advisory Committee on Immunization Practices recommends the use of the RSV monoclonal antibody to all infants starting at birth through 24 months during the RSV respiratory season. By providing this monoclonal antibody, will help decrease hospitalizations and severe disease by 70%. So that's pretty significant for our patients. It is especially important for premature babies. We will also have adult RSV, which is amazing because we can provide that for women that are 32 to 36 weeks gestation, that will provide passive immunity to newborns for 5 months during the respiratory virus season. So hopefully it can get through, that baby can get through without immunity until it gets its own, gets through that season. We not only have to worry about little ones, we have to worry about the aged or the elderly and people with comorbidities. So RSV in the United States leads to approximately 60 to 160,000 hospitalizations and 6,000 to 10,000 deaths among adults over 65. By providing the adult RSV immunization, this will help decrease morbidity and mortality rates, which will help save money in the long term for our community. So finally, what I'd like to do is address some of the challenges that we have in immunizations and opportunities to improve services. In South Bend, one of the major issues that our patients are saying is we do not have parking. So it takes a while if they have an appointment at 11 o'clock, if they're not really familiar with our downtown area, they may be 15, 20 minutes late to an appointment. And which may not seem like a lot, but when you have a full schedule, it causes later times because we're trying to see every individual that comes in. So it's an issue. The other thing are no-shows or cancellations. And the people that my registrar has talked to has said that it's because of parking a lot of times, and also because we don't have a first floor clinic. But we do in Mishawaka, which is awesome. So we can send them there. However, the limitations we have there are we cannot have later clinics. We can only work until 4:30 because of security there. And we have a smaller clinic room. So we have patients that want to go over there, but we just don't have the area to have, 2 rooms running like we do in South Bend. So those are some of the challenges we have. So in summary, we have a lot of wonderful programs, and we are able to reach and provide education, better access for people in the community, which is wonderful. Public health, since we're getting more staff, we'll be able to take on our cases again from state, so we can investigate, follow up on the communicable diseases in the area, those 71s. And hopefully provide more access to clinical providers, resources, and medications. So that's an ongoing thing, I know. Immunizations, we have 4 clinics, which is amazing, 2 in-house, 1 mobile, 1 respiratory, providing more appointments, and we're trying to work to protect our community. And we will always work on parking, I think, and trying to find a first floor for South Bend. But I am very appreciative of my job and the health department. So, thank you. So, any questions?
Thank you. Any questions?
Does a patient have to have an appointment to get an immunization, or do you take walk-ins?
We do take walk-ins, but right now, since we're so busy, we prefer appointments. Just because we have limited spots. But if someone comes in and if we don't have someone show up for their appointment, of course, we fill them. We try to keep busy.
I know there has been a lot of discussion among a lot of players in the county regarding figuring out better space for the health department, especially the immunization clinics. Do you have any updates or kind of where things stand right now?
We've brought these issues up to the commissioners so that they are aware as they think about the spacing and where the health department should follow through. Right now, we're doing our best to manage with the overall growth in the health department, and there's a building right across the street that we were given a couple of extra rooms on the 3rd floor that we're gonna start utilizing. That's separate for our immunization clinic and staff, but just in terms of the overall growth for the health department, that is what we're using for our immediate needs. But long-term plans, I know the commissioners are working on being very thoughtful about how we grow as in the bigger picture and their understanding of our needs. So yeah, more to come, I'm sure, but immediately we're using the building right across from us to help with some of the needs.
But are there any client facing things that are happening in that building, or is
We-
everything still?
We do have our CHWs in that other building, and they do sometimes have clients from the community come to
Okay.
visit the CHWs to do some of their social needs assessments.
Okay. When people call to make appointments, do you try to direct them to the Mishawaka Clinic if they have a car? Or how do you kind of
We
play that?
basically just tell them where our clinics are, and if we know we're having a mobile somewhere, we will tell them about that and try to sign them up for those clinics.
Okay.
What percentage of people do you think use the online appointment scheduling? Is that very popular? Do people sign up for appointments online?
Yeah, probably about 70%.
70%?
Yeah.
Okay.
I think in general, we notice that our community engages better electronically. Like when we looked at the surveys that we did, 95% of the people that did the surveys did not attend events. So in terms of thinking more broadly about how we outreach our community, being thoughtful about our electronic communication is going to be something that'll be helpful. But we see that everywhere in terms of how they engage.
Any other questions for Jody or Dr. Purushottam?
I guess I just have one last question. With tuberculosis, what is kind of the trend with that? Is it are you having more active and latent cases? Is it kind of steady, it's
It's
declining?
been kind of steady. We've been holding at 2 cases, active cases, for quite a while. Our nurse and her assistant has been very, very good about working. We work with Beacon, with the refugees that come through there. My disease investigation specialist goes there to do input and help with resources. So our latent ones have been staying consistent to around 70 to 80.
And especially for the active cases, even with receiving limited medications, do you have enough to treat, especially the active cases right away? Is it?
Oh, absolutely.
Okay.
Yeah,
Yeah.
because the state wants to hold back some of the medications specifically for active.
Okay,
So we have that pool to pull from
Okay.
Purdue Pharmacy.
okay.
Anything else?
Thank you, Jody. We really
the-
appreciate all your hard work.
Yeah,
Thank
thank you,
you.
Jody. We
Thank you,
appreciate
guys.
you and your staff and everything you do for the county. So thank you.
John, I just wanted to give one update on the drug shortages. You would be surprised of the number of drugs that there's in short supply. If you Google drug shortages 2023, common drugs like high blood pressure pills that everybody takes, diabetes medicines, a lot of times it's because a manufacturer just doesn't find it profitable to make them anymore. But there are a ton of drug shortages right now. We're finding it in the clinics, having trouble coming up with very common moxicillin, very common drugs.
Great.
Don't get sick.
Yeah, really. Stay healthy. Anything else? No. All right, thank you very much. Moving on to the next item, new business. Item 2380, discussion and vote job descriptions, Director of Community Partnerships and Development. Who's got that?
Yes, before you is a revised job description. You should have received a copy as you came in today. Some minor edits were made on the job description. It is a brand new position that we would like to include in our Health First Indiana funding. And it would be the Director of Community Partnerships and Development. And they would work with the Department of Health as well as the community partners to create relationships as well as help with the grant funding process through Health First Indiana, help the Department of Health write and receive grants, as well as help review the grants that we'll be going through shortly with our grant cycle. But it will be a new position, and we would request it to be on the council agenda for December for a final vote in January. So we're hoping to be able to post for the position middle of January.
Thank you. Any discussion, or I'll entertain a motion? So inclined.
I move to accept the job description for Director of Community Partnerships and Development.
We have a motion. Do we have a second? We have a motion and a second. Any further discussion on this item? All right, hearing none, I'll call for the vote. All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, item 2381, discussion and vote budgets. Health First Indiana Fund 1161.
And this budget is slightly different than what the Finance Committee had approved at their meeting. We did include in this budget the position that was just approved, the job description. So we did include the Director of Community Partnerships and Development, as well as the benefits for that position. Otherwise, I will go through the budget as it's here. The column labeled 40%. Those are the services that we cannot spend more than 40% of the HFI funding on. That pertains to environmental health, food services, and the pool inspections. So that column, we need to make sure we stay under the 40%, which with the budget we are proposing, it does. Another thing I wanted to point out is if you are looking at positions, let's say, for instance, if we're looking at the perinatal lead coordinator on the first page, the salary that we are requesting is $28,350. That is because that position is currently grant funded through June of 2024. So we are only asking for the amount needed to take that position to the end of the calendar year of 2024. Same thing with benefits. So some things may not calculate out evenly because we are only adding in for those positions the amounts that are needed to take us to the end of the calendar year in 2024. And then everything else just goes down per category, other personnel services, office supplies. We do have some items, some buckets set up because we weren't sure exactly how we were going to utilize those funds, but we knew we wanted to have a bucket for the Department of Health to address maternal and child health, to address trauma and injury prevention. So we have those buckets set up in our budget so we can address those needs as they come up. So at the end of the spreadsheet, it does show what we have spent in our budget, which is the $2.319 million, which does leave around $973,000, which is the amount that we are offering for our community partners to apply for grant funding that we will have our community meeting for on Monday. And we do have a chart also attached that shows by course service how much we are funding that course service, whether it be Department of Health funds or grant funds that we are offering. On the, oh, go ahead.
Oh, I'm sorry.
No,
So
go ahead.
the pie graph right
Yes,
here. So the pie graph chart, the money that is in grants, is that distributed roughly how much of each type of grant might go to, say, something related to maternal health, infant health, or?
that should be on the page right before the pie chart.
Okay,
If we go down to that page, it does have towards the bottom the amount that is the Department of Health need, and then what grant, what dollar amount we are offering in grants for that core service.
oh, okay, okay,
And then it does give the percentage of the FHI budget that is being used for that core service. And then the pie chart just puts it in a pretty
okay. Okay, all right.
pretty
thank
chart
you.
to review, but yes, we do have it broken down specifically, by dollar amount for each core service that is listed in Health First Indiana that we must make available to those in St. Joseph County.
Okay.
Any questions on this item?
I guess I also just realized this vital records, there's a little bit of software and rebinding books. That's in the 60% though. That's not something.
Vital
that's-
records is considered in the 60%.
Oh, okay. That's nice.
Yes.
Okay, great.
Yes.
Did I see a $200,000 budget on binding books?
Yeah.
Tell us about that.
Our vital records vault has these books that date back to late 1800s, early 1900s that they have to go to find birth and death records. So of course you can imagine over time they're falling apart, and that's the only copy that exists of that record. And the Department of Health has never had funds available to rebind those records. So we have requested that service to be done since we have funds available to be able to rebind those records. It was suggested maybe look to make those in an electronic format. We haven't explored that option. We just want to make sure that those books that we have in South Bend as well as Mishawaka, that we can get those put back to like new condition.
Any other questions or comments on the budget before you?
I move to accept this budget as stated.
We have a motion. Do we have a second? A motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
I
Opposed, same sign. Motion carries. Next item on the agenda, grant request, non-old business. We have no old business. So we're on to public comment. We have nobody signed up for public comment. But we do have somebody holding their hand up, but I'm.
Amy Drake, I'm County Council member on the fourth floor here. I just wanted to bring up an issue. I've gotten a few phone calls about mosquito spray. And people are upset that it's happening without much warning. I was told that the warnings are on the website. And so I'm asking if you guys could think of any better way to communicate, because most people aren't going to go to the website and look. Maybe a Facebook ad or get together an email list or something like that. I think that would be helpful to communicate. Another point I just wanted to mention about the grants that you're talking about. I love the grants for Health First. I think it would be a really good newspaper story, and that would also get you more publicity and maybe touch somebody that would not have otherwise been involved in the process. And last, someone came up to me and said, will some of the Health First money go to more programs helping seniors? So just wanted to make that suggestion on his behalf. That's it. Thank you.
Thank you. All right. Next item on the agenda, time and place of our next regular meeting will be November 15th at 4:30, and we will be on the 8th floor due to a conflict, so we'll be up in the conference room, boardroom on the 8th floor. Last item on. Yeah, we're in. Follow up with that.
Oh.
Last item on the agenda is an adjournment. So, I'll entertain a motion to adjourn.
I move to adjourn.
Motion, do we have a second? All right, all those in favor, please say aye.
Aye.
Opposed, same sign. We are adjourned.
You know, I'm gonna do it.